Good evening. New data shows more surgeries are being done across Canada, but wait times are growing, especially compared to before the pandemic. Alberta is making some progress on waits for knee and hip replacements, but is lagging behind in cancer surgeries and diagnostic imaging. For those waiting for critical care, it's a painful delay. Jordan Canagan reports.
Jim Wells is used to capturing other people's stories. Now he's sharing his own.
The top of my femur is disintegrating. I've got some very deep bone bruising all the way down my thigh. I've got some stress fractures.
He's been waiting more than 6 months for a hip replacement, meaning the longtime post-media visual journalist is one of the thousands of Canadians on growing wait lists for critical surgery.
Yeah, you got to be patient. I know for a fact that there's a lot more people that are worse off than me.
He's not alone. A new report from the Canadian Institute for Health Information shows wait lists are longer now than before the pandemic. People are waiting months for hip and knee replacements, cancer surgery, and MRIs and CT scans.
This could have impacts on the pain that they're experiencing, their mobility, in the case of, say, joint replacement procedures, the quality of life, and maybe in some cases, the anxiety and the stress of waiting.
However, Alberta is improving in some areas compared to national trends. The province performed a record 318,000 surgeries last year, exceeding projections. A statement from the province's new Surgical Services Ministry says Alberta's government knows there is more work to do, particularly on cancer surgical wait times. We are committed to improving the timeliness and accessibility of healthcare in the province to ensure every Albertan receives the care they need within clinically recommended timelines.
We're still continuing to face shortages, which impacts the ability of systems to really address the wait times for patients.
Wells has a first meeting with a surgeon next month, with hopes an operation date comes soon after that.
I just want to get back to the normal life that I had.
Jordan Canagan, CTV News, Calgary.
The Health Institute says though more surgeries are being performed, it is not keeping up with population growth.